On this episode, two medical mysteries that defied the experts.
Doctors thought they knew what was causing the unbearable pain in Terry Moore's body, but they were wrong.
I remember one time crying, saying, I can't take it. It just hurts too bad.
Liz Holzheimer wanted desperately to have a baby, but while trying to create a new life, she almost lost her own.
I was like a walking time bomb. I really began to feel there's a missing piece to this puzzle, and I have to find it.
Sam was cured when she was still very young. She has a whole healthy life ahead of her. But imagine a different scenario. You're a college student, a basketball player. Then one day, you are told you have a crippling, incurable disease. It happened to Terry Moore.
In 1998, I was a junior in college at James Madison University, playing a lot of basketball, played every day pretty much. And I come home for spring break, and I wake up, it was Monday or Tuesday morning, and my knee was completely swollen and hot to the touch. And I tried to go to bed that night, and it hurt so bad, I couldn't leave it flat on a bed, so I slept on the couch. It was so much pain that I couldn't have the ceiling fan on. I could sense the breeze when our pet walked by, just horrible.
But Liz Holzheimer's problems didn't start until she and her husband Mark, a professional baseball player, decided that it was time to start a little league of their own.
I was 30 years old at the time, and I happily flushed my last packet of birth control pills down the toilet, and I thought, if it's anything like teachers tell you in high school, I should be pregnant in no time. But it just seemed like month after month went by, and I still hadn't had a period.
Fluid drained from Terry's knee indicated that he might have gout, inflammation of the joints caused by a buildup of uric acid in the body. But the rheumatologist he was referred to disputed the diagnosis, and with good reason, according to Terry's internist, Dr. Fred Tawil.
He did not have the kind of classic gout presentation that we see in internal medicine. Typical gout attack in an internal medicine is a man in his 40s, usually overweight, who has a family history of gout, who comes in with an acutely swollen joint, usually a toe joint.
Concerned, Liz finally makes an appointment with her gynecologist, Dr. Rhonda McVeigh, who runs a blood test to check Liz's hormone levels. When the tests come back normal, Dr. McVeigh encourages Liz to be patient.
It'll take the body a little while to get adjusted to being off the pill, to start having regular periods. In the scheme of things of trying to get pregnant, this isn't very long.
But as far as Liz is concerned, it can't happen fast enough.
I knew she was really wanting to get pregnant. I knew she was frustrated. The biological clock was really kicking in.
It was amazing how many of our friends were having kids. So, it's going to happen for us. It's going to happen at the right time. But after a while, it really started to affect her.
I was very anxious, and I remember Mark was on the road at that time, and he would call every night and ask me, well, how are you feeling? And I said, well, just keep your fingers crossed, and hopefully it will work.
The rheumatologist told Terry it looked like he had a form of inflammatory arthritis, but arthritis can be difficult to diagnose.
Unfortunately, with a lot of the inflammatory arthritis, there isn't a lot of times one test or one thing you can say, oh, that's what it is. Frequently, it's a syndrome. It's a combination of symptoms.
Terry started taking anti-inflammatory medication.
Didn't really tell a whole lot of people. Was always embarrassed about why I was limping around. I'm 22 and I have arthritis. That's not fun to say to your friends.
When we first met, Terry was hobbling around a lot, and of course you ask what's wrong or what's going on.
Pretty much I think I told her I just had a sports injury.
I thought, here's this outgoing, really nice, super nice guy who's athletic that just happened to hurt his knee, and didn't really think that much of it.
But after being with her for a little while, she kind of figured there's something else going on.
A few more months go by, and Liz still hasn't had a period. She goes back to Dr. McVeigh, who decides to inject her with the hormone progesterone to see if it can trigger ovulation.
What ovulation means is that an egg in a woman's ovary needs to mature to the point that it can be fertilized. And she was not doing that. She was not ovulating.
Dr. McVeigh also suggests Liz try an oral fertility drug to induce ovulation, but it has significant side effects, and Liz is not ready to take that step.
It was really frustrating not knowing what was going on with my body and why I couldn't become pregnant. It just didn't make sense. It seemed like the summer that everyone was having a baby, except for me.
Over the course of his senior year in college, the anti-inflammatories stopped working, and Terry's pain got worse.
There were times at school he'd call and he just couldn't walk. The pain was so bad in the knee or in the foot that he would use crutches to get around with.
It was really hard to watch him go through all of the flare-ups and then the flare-up to go away and then come back maybe a week, maybe 2 weeks later. It was this constant roller coaster of what are we going to be able to do and what aren't we going to be able to do.
Graduated in '99, and same things are still happening.
Terry had been under treatment for 2 years, but the pain was still crippling. His rheumatologist tried a more aggressive approach, putting him on 2 new drugs, prednisone, a steroid, and methotrexate, a drug used in chemotherapy.
The methotrexate is kind of made me, sick to my stomach.
It pretty much, as soon as he took it, would be so horribly nauseous that he would just want to go to sleep.
And with the prednisone, kind of makes you gain weight, and I started feeling fatter, and my hair actually just started thinning out a little bit. Now I'm 23, 24, and starting to look chubby and losing my hair. So it didn't feel great.
The past year has felt like an eternity to Liz Holzheimer. She desperately wants to get pregnant, but has been told that she isn't ovulating. Now she's starting to wonder if the anxiety of it all is beginning to affect her physically.
If I got up too quickly, I'd have a dizzy spell, but I didn't really think too much of it at the time. I just thought, well, maybe it's the fact that I'm just really worried about trying to have a baby. So I just kind of kept it to the back of my mind and thought, well, I'm not going to worry about it right now.
But soon, Mark sees the warning signs with his own eyes.
We used to go see movies a lot, and when the show was over, we'd get up, and it was still dark in the theater, and she would always stumble. I really didn't think much of it, and I don't know if she thought much of it.
Gradually, the dizzy spells become more intense.
It was almost like if I were to have an acid trip, that's what it would be like. Just colors would become more vibrant and brilliant. If I looked at, trees in the backyard, it was almost as if the leaves would start to move and come to life. They would come on so quickly, and then as soon as the onset began, it was just over. And afterwards, I would just feel fatigued, and then it would just subside, and I thought, maybe it's just the stress, or I spent too much time being out in the sun today.
Then, suddenly, the hallucinations give way to excruciating headaches.
The headaches just knocked me down. I remember one evening where I just had the most excruciating migraine I had ever experienced in my life.
She had never had migraines before, and she could hardly raise her head, and it was really bothering her.
But because I never lost consciousness, I thought, well, it can't be that serious if, I haven't fallen over and collapsed.
Even with the new, powerful drugs, Terry's flare-ups got more frequent, each one more painful than the last.
I stopped sports altogether at that point.
It was almost like he was a totally different person. On a daily basis, you didn't really think about it, but when you took a step back, you went, we're not doing anything that we used to do.
Terry's doctor told him that he probably had rheumatoid arthritis, a very severe and debilitating form of the disease. With rheumatoid arthritis, the body's natural immune system goes haywire and attacks healthy joint tissue. It can cause permanent damage to bone and cartilage. Joints can become deformed and lose all range of motion.
That just hit us like a bomb had dropped on us. We knew how debilitating rheumatoid arthritis could be.
And Kim and I had conversations about what's my future going to be. Is she going to be pushing me in a wheelchair when I'm 35 or 40?
I never pictured a life not with Terry, and I never pictured us being apart, and I knew we would be together forever, but I didn't know how the day-to-day would be.
She just stood by him and was always there for him. And I think in his mind that, you know, do I really want to have her go through this not knowing what the outcome's going to be?
The crippling pain also started taking a toll on Terry's mental health. In April 2002, after suffering with the disease for 4 years, Terry was desperate. He went to Dr. Tawil for help.
And I told him, you know, I'm coming to you because I have rheumatoid arthritis, and I'm not getting much better. I'm actually kind of feeling worse, but I'm getting depressed. You know, I'm always in a bad mood, feeling down.
He was facing a lifelong chronic disease that was going to cause him lifelong misery, at least to a certain extent, which would require medications that were certainly not benign, which would cause potential side effects in future health issues.
Dr. Tawil prescribed antidepressants. Terry's mood got better, but his joint pain continued to get worse.
But within weeks, Liz notices that she's changing mentally as well as physically.
I had no desire to get out of bed. I declined to go out with friends, and I knew just as well as they did that wasn't the Liz they knew, or I knew. Those feelings of depression really started to scare me.
Liz wasn't the happy person that she was when I first met her, and I was concerned about that change.
I remember meeting with a doctor, and I was given a prescription for an antidepressant, but it only made me feel worse.
Liz attributes the depression to her infertility and makes an appointment with her gynecologist. Dr. McVeigh orders a more in-depth examination of her uterus and fallopian tubes, as well as tests for Mark. When all the tests come back normal, Liz finally decides to try the oral fertility treatment.
After the oral fertility treatment failed, I just thought, what can it be?
At that point, I labeled her as unexplained infertility, and I referred her on to the fertility specialist.
February 3rd of that year, of 2003, my elbow was inflamed. I wasn't feeling well. I took my temperature, and I had it was like a 101, a 102. Started throwing up. Thought I had the flu, and it was just intensified by having a flare-up in my elbow.
Terry called his rheumatologist the next day. He suspected it was an infection and prescribed antibiotics. But by the following morning, Terry could barely move his arm.
I walked into Kim and I said, I can't take it.
And he started crying, and he started saying, I want to die. I cannot live like this. And he was resolved to the fact that he would rather die than have this pain ever again, let alone for the rest of his life.
Based on her previous test results, the fertility specialist diagnoses Liz with hypogonadotrophism.
He said, basically, Liz, your ovaries have prematurely shut down. Your best and only chance of having a child safe for adoption is through in vitro. And I was just devastated with the news. I thought, how can this happen?
She wanted to see if there's anything else we could check into.
I really began to feel that there's a missing piece to this puzzle, and I have to find it.
In January of 2000, she came back, and I was actually just talking to her before the exam, and she says, you know, I've been really dizzy, I've been tired, I've been having these headaches.
I just said, is there any way we can have another test, you know, a CAT scan, an MRI?
After Liz and I discussed her dizziness and headaches, we decided it was time to move to some further studies.
2 days later, Liz has an MRI. She wonders if it will be just one more test that comes back normal.
The phone rang. All I heard on the other end was this even, gravelly voice saying, I have your MRI results. My heart just started pounding. This voice just continued, and it said, you have a meningioma. I'm like, a mini what? What is it? I opened up my nightstand drawer, and I pulled out a lip liner, and I just said, can you just tell me how to spell that? And he said, you have a brain tumor. My whole world just collapsed at that moment.
A meningioma is a common type of slow-growing brain tumor that is rarely cancerous. It forms in the dura, the membrane that covers the brain and the spinal cord. As a meningioma grows, it puts pressure on the brain. Depending on its location, it can cause anything from personality changes to motor difficulties.
Suddenly, I had a neurosurgeon, and I was going to meet him today.
Well, it was a tumor that measured 5 to 7 centimeters in diameter, so it was quite a large tumor.
I just remember Dr. Fulliger just illuminating images of my brain all around his office.
I said, holy is that the tumor? I can't believe that.
It had pressed my brain all the way to the other side.
The pressure on her brain was causing her dizziness, hallucinations, headaches, and depression. It was also pressing on Liz's pituitary gland, impairing the production of the hormones that cause ovulation.
He said it needs to come out, and it needs to come out as soon as it can.
The idea of brain surgery was horrifying. I literally did not know would I come out after surgery.
But Liz has no other choice. The tumor has to be removed.
It was February 10th, 2000, and I had to check into the hospital the night before my surgery.
I didn't really ever think that I was going to lose her until before they took her away. The last thing I said to her was, next time we're in the hospital, it'll be because we're having a baby.
And I just took those words with me as I was being wheeled away.
By 2003, Terry Moore's life had become a living hell. 5 years earlier, he had been diagnosed with a crippling form of arthritis, and now his elbow was in such pain that he didn't want to go on. Desperate, he dragged himself to the emergency room.
I remember walking in, and it was almost like, I'm here, almost feel like I fell forward and just said, take me.
The ER attending took one look at Terry's elbow and called an orthopedic surgeon.
Given that he was not responding to the antibiotics, I recommended to Terry that the plan of action would be to proceed with operative treatment. Go in and remove the inflamed tissue and see what we find. Came into the operating room and cut through the skin of the back of the elbow, and immediately there was fluid that came out. But to my surprise, there was no pus. Pus being the byproduct of an infection. And then I proceeded to excise all of this material that was white, thick cottage cheese in nature.
The next day, Dr. Aguiar told Terry and Kim about the cottage cheesy material he had found, but explained that they would have to wait for the pathology report to come back to see what had caused it. In the meantime, Kim did some research of her own.
I started doing some searches on the internet for things like rheumatoid arthritis and cottage cheese. And that's when all these articles started coming up about gout, and the pictures were horrific. And that's when I called Terry, and he said, that's what they told me I had in the beginning.
Her only option is brain surgery.
Well, the goal of the surgery is to remove the tumor entirely. As the tumor gets larger, the technical aspects of removal of the tumor increase in difficulty. We make an incision and have to remove a sizable piece of the skull to access the tumor.
And I was a nervous wreck, I'm walking around, trying not to think about stuff. My whole family was there, Liz's family was there.
I think our anxiety was high, but his had to be so much higher.
It will take 12 grueling hours to try and remove the enormous tumor.
When I woke up, I was just elated. I was alive. They took it out, and I survived.
Liz spends the next year recuperating.
It was the recovery that, for me, it was sheer hell. I was languishing on the couch, and I just wanted to get back to my life the way that I had known it before.
Kim's discovery was shocking. Could the source of Terry's misery be gout? The same disease he had been diagnosed with 5 years earlier? At Terry's follow-up visit, Kim asked Dr. Aguiar.
I said, well, you're right, it's possible. When you have a patient with a swollen joint, there's a huge list of possibilities that it could be. Rheumatoid arthritis, gout arthritis, Reiter's, psoriatic arthritis, infection can cause arthritis, the list goes on. Gout, in Terry's case, was not top of my list when I saw him in the hospital because it looked to me like infection.
But when the pathology report came back from the lab, it showed that the material found in Terry's arm was full of uric acid crystals, a sure sign of gout, the same diagnosis that had been dismissed 5 years earlier. The discovery was staggering.
Terry said, well, does that mean that I don't have rheumatoid arthritis? I said, well, sometimes you can have both conditions, but to me, what's going on in your elbow is clearly gout. And he asked me, does that mean that that's what I've had in my other joints? And I said, it's very possible.
A urine test confirmed that Terry's uric acid levels were sky high. In healthy people, uric acid is excreted by the kidneys. But in Terry's case, his body was producing too much uric acid for his kidneys to handle. It was flooding his body and causing his joints to swell. Gout symptoms can be similar to arthritis, but the reality is that for 5 long years, Terry had been treated for the wrong disease.
When I heard it, I got very angry about it. It wasn't so much anger at any specific person. It was just an overall, what have we been doing for 5 years?
Every time I went to see a doctor in the previous 4 or 5 years, I'd gone in saying, I have this syndrome or I have rheumatoid arthritis. And that's pretty much how I was treated.
And I was guilty of being caught up with his diagnosis. He presented with a 5-year history of presumed rheumatoid arthritis, so I assumed he had rheumatoid arthritis.
Young and otherwise healthy, Terry was not a typical gout patient. But as he's learned, it's important to look beyond the obvious.
A year and a half after her surgery, Liz goes in for a routine appointment with Dr. McVeigh.
At her annual exam visit, she mentioned that she had been having periods for 3 to 4 months, but the one that was due had not come.
And I felt just incredibly fatigued again, and I was becoming really emotional and irritable, and I just thought, oh, what's going on with me now?
So we were both worried, is the brain tumor coming back? We decided to do a blood test. They called me with the results that evening, and then I called Liz at home.
Liz, I have some great news for you. You're pregnant. Congratulations. I literally just fell over and I said, are you sure you're looking up the right chart?
I was really excited and I was very glad to be able to call her.
I couldn't believe it. I was finally going to be a mom.
It was one of the best days of my life. I mean, to go through what we went through, to have all that happen and to have something, magical come out of it was awesome.
A year and a half after her daughter's birth, Liz finds out she's pregnant again. This time with a son.
So I feel doubly blessed that I have these 2 miracles. They saved my life, because had I not been trying to have a family, I would never have discovered that I had a brain tumor, or it would have been discovered too late.
With Liz, there was no reason to suspect a brain tumor just because she wasn't having cycles. Nobody would have thought brain tumor at that point.
It just makes you wonder how many healthy people are out walking around harboring a life-threatening illness.
In Liz's case, she was fortunate they discovered it when they did.
The brain accommodates to a tumor growing slowly, and it will accommodate, and then it can't accommodate anymore, and then it can compromise the brain to the point where the patient can't survive.
There's a lot about medicine that is not logarithmic, and clearly it is an art. It's really incumbent upon us as patients to ask the right questions, to seek the right answers.
The way I would look at treating or getting treated in the future is being aggressive myself and doing more research as far as what your symptoms may be.
Terry went off the arthritis medication immediately and started taking drugs to cure his gout.
It was just amazing, the difference in his personality.
Within a month, I was feeling better, and by that May, I was playing basketball again, and I still have problems occasionally, but nowhere near the severity and nowhere near the length when they do occur.
He went off the antidepressants and has been for, I'd want to say, over a year now. He was just such a happier person, physically, mentally, the whole deal.
I think that's what gave him the courage and all to ask Kim to marry him.
The whole time Kim was my support, and couldn't have gotten through any of it without her. I don't foresee anything that we couldn't handle together.
Terry had been misdiagnosed for 5 years. What he did have was treatable. For others, an accurate diagnosis can mean the difference between life and death.